Right now, 12 above.
Welcome to Sport and Spinal Weekly, brought to you by Chiropractic Sport and Spinal Rehab. Listen each week for health and wellness programs and ideas, chiropractic information, and helpful tips for a healthier lifestyle. Plus, weekly guests from around the area. It's time for Sport and Spinal Weekly with Dr. Lyle Erickson and the team at Chiropractic Sport and Spinal Rehab.
Sport and Spinal Weekly, here we are again, the end of a week, a discussion with Dr. Erickson and the staff at Chiropractic Sport and Spinal Rehab. And a new feature that you already have it at the clinic, but some continuing education you have that we'll talk about today.
Yeah, welcome to everybody today. I've been gone for a couple weeks here.
Yeah.
Dr. Levikin, and he's done a great job talking about headaches. Today we're going to go on a little different tangent, and we're going to talk about kind of preventing back injuries, and injuries to your spine in general. And as you'd mentioned, we've over the past few years, I've done a lot of community service doing talks on back safety. One of the programs that we teach is called Powerlift training, and basically what Powerlift training is teaching people how to lift properly and not injure their back. So and recently I went down and got certified in teaching Powerlift training specifically for assisted living homes and extended care facilities. So teaching people who transfer move patients how to lift properly and avoid back injury.
And then our guest today will be Jason Brodina.
Yeah, Jason Brodina from Choice Therapy will be coming in, and he'll be talking about some physical therapy things.
And then not too far back, you guys had some activity up in Kelliher, and you did an event. How did that go?
Oh, yeah, we had a great grand opening open house. Yeah, we had a great time. We cooked chili. I think we had over, it was 100 people there or so.
Wow.
Gave away a cool ice fishing trip out on Red Lake. And, northern Beltrami County, and, this is a great region up there, just phenomenal people, and so we're really happy to be able to provide chiropractic care for those folks.
So we'll be talking about your back and lifting, proper techniques. Jason Brodina from Choice Therapy, all coming up on this week's edition of Sport and Spinal Weekly.
You're listening to Sport and Spinal Weekly on 92.1 The River.
Have you ever been told you just have to live with the pain? Far too many people today are living needlessly with pain and taking drugs to hide their pain. Every day, many people just like you are learning chiropractic care can be an effective alternative to drugs and surgery while restoring pain-free living.
For quality chiropractic care, call Chiropractic Sport and Spinal Rehab of Bemidji at 444-2117. Whether caused by an auto accident, work injury, or other circumstance, receive expert treatment from Sport and Spinal Rehab. Sport and Spinal Rehab will accept most insurance, so give them a call. That number again is 444-2117, or find them on the web at www.sportandspinalrehab.com.
Chiropractic Sport and Spinal Rehab. Renew your whole body, your whole family, your whole life.
For more information, visit Chiropractic Sport and Spinal Rehab online at www.sportandspinalrehab.com. Your recovery from injury is so important to you and your family. If you or someone you love is in need of physical or occupational therapy, request Choice Therapy of Bemidji. You do have the right to choose where you receive therapy services. Choice Therapy will work closely with your physician, giving every patient the highest quality care possible. Choice Therapy also offers free 15-minute injury consultations to see if therapy will help you return to top form. Your life, your health, your choice. Choice Therapy of Bemidji. Get fit now at the Gillette Fitness Center, located on the BSU campus in Bemidji. Go for a swim, run a few laps, take a yoga class, or just work out. It's all here for you. The Gillette Fitness Center offers state-of-the-art equipment and facilities that will help you slim down, tone up, de-stress, or just plain play. With flexible membership options to help you achieve your fitness goals. Open 7 days a week. Visit the Gillette Fitness Center, located on the BSU campus in Bemidji.
Hi, I'm Erica at Chiropractic Sport and Spinal Rehab. I assist the doctors with patient care, exams, therapy, and x-rays. Call us to find out how we can help get you out of pain today.
All right, welcome back to Sport and Spinal Weekly. with Chiropractic Sport and Spinal Rehab. You can always email Sport and Spinal Weekly at paulbunyan.net, or doctor, or website.
The website, our clinic is www.sportandspinalrehab.com, all spelled out.
Well, as we get started here, you're saying that it is a busy time of year. And it seems like as soon as you get done with the holidays, then it's January, and you're thinking, I got some time to relax a little bit. And if you've got kids, or, well, even if you don't, you can end up being pretty busy.
Yeah, it's just a busy time of year for everybody with the, athletic seasons and the, the fine art seasons. And if you got kids and doing this and that, and the school years, the kids are getting antsy with that. And, they're thinking about spring break and summer vacations. And busy time of year, but a fun time of year, and finally got some winter, so that's kind of cool, too.
That is neat. Speaking of that, I know that our topic today will be about proper lifting, but I'm sure because we're shoveling now, and it's a heavy snow, and they say a pretty good system Sunday and Monday. So one thing we should always keep in mind that when we're shoveling?
Well, the big thing is, and some of the talk today is going to regard some of that as well, but the big thing is when you're shoveling, the number one cause of back injuries is the mechanical procedure of bending, twisting, and lifting. And if you can kind of picture in your mind right now what most people do when they shovel snow,
right?
They bend, twist, and lift. Plus that load of the shovel, the weight of the shovel is out in front of you. And so, you're compounding things because of leverage puts a lot more pressure on your low back. So, this can be our tip of the week, so to speak. But, to really avoid, if you can, bending, twisting, and lifting, you move your feet instead of your torso when you're lifting. And then, use a good wide stance and use your legs and not your back. So, lots of back injuries happen with snow shoveling. Or the alternative, go south.
Go south?
Yeah.
Or snowblower.
Or snowblower.
Now, as you were talking, I think that's very encouraging and should be something that should intrigue some listeners and maybe potential clients of yours. But I would assume in your field, like all medical fields, continuing your education just provides more for your clients and your patients. And I see that you guys do that.
Yeah, we're required to do some, continuing ed, just to keep our licensure, just like every, many professions are. One of the things that we've done at our office that I've done personally is gotten certified into how to train folks to lift properly. Not that I didn't really know how to do it before getting the one-on-one specific training, but what I found, and I got trained here a couple of years ago in a technique called Powerlift training. Okay. And Powerlift training was created by a doctor, Dr. Mike Schaefer, here probably 25 years ago, and he was smart enough to actually patent the technique. And so he has a Powerlift training program that he teaches to chiropractors, and he is a chiropractor himself, but now he exclusively trains, large companies across the world. So I was fortunate enough to get trained by his program and how to then train people how to lift properly.
Wow.
So a cool thing, and what I found was I'd done a lot of back safety training per se before taking this training, and it wasn't that I was training people wrong, but I wasn't training them in the best technique out there. And I really believe that this training, the Powerlift, is the best way to train folks on how to lift properly.
Now, does it require some type of device or anything? Sometimes, I don't know, I've seen people, they have straps or something. And
that's a great question. That really gets into more ergonomics.
Okay.
And so when we train Powerlift training, we're teaching body mechanics. We're basically material handling, which you're doing all the time because we're always handling material, because we're handling our body weight all the time. Okay. So you have a poor mechanics with your body weight, or with your body position, you're going to be carrying that body weight in a bad way, increasing your chances of injuring your back. So the training that we do is all, it's a little bit of lecture training, teaching people about the structures of the spine. Then it's also just hands-on. We teach people how to lift. We go from, we have props. We lift boxes and bigger boxes and, different poles on the ground and, just different things, and train people how to lift properly, both in the workplace and at home.
Well, I guess my question is, are our bodies designed to do a lot of lifting that we do?
Not necessarily. I mean, our bodies can, our bodies are a phenomenal, piece of machinery, and they're designed to take a lot of abuse. And so they are designed, the spine, the discs are designed to take a lot of pressure if that pressure is put on them in the right way.
Okay.
And so your discs can withstand a lot of force, but if they're not in a good structural position, they can't withstand that force, and then they break down, and that's when injuries happen. So if you're, the old adage is, well, you tell me. I'm going to ask you how would you've heard it 1,000 times. What's the most proper way to pick up a box off the floor?
With your legs, they say.
Yeah, exactly, right? Feet, how far apart? Feet, shoulder width apart.
Wide stance. I can remember wide feet. Lift with your legs.
Feet shoulder width apart. Keep your back straight. Lift with your legs. Okay, and that's a good technique that does have some flaws to it.
A lot of flaws because I've hurt my back doing that, Doctor.
Yeah, and so the powerlift technique is a kind of a divergence on that, just a little bit. And we teach a even wider. I love the word you used, wide stance, because that's what we teach. But we teach a really, really wide stance, and we add to that some different nuances as well that really puts your back in a power position. And it makes you lift with your legs and not your back. I mean,
so you kind of like get in a squat, because that's how I have to lift stuff.
Yeah, it's a squat position. It's really wide stance. It's a really kind of an athletic position. And what we like to say is lift with your legs like an elevator, and not with your back like a crane. And really the training that we do for companies when we go out and train a company is we'll see guys that are 250 pounds and they're muscle bound, and let me tell you, those guys can hurt their backs
just as easy,
real quickly with poor technique. And one of the reasons is because your body weight, if you think about your own body, 2/3 of your body weight is above your hips. Okay,
that's true.
Yeah, and so you're always, no matter if let's say you drop a pen on the floor and you go to pick it up, well, you're not only lifting the weight of the pen, you're lifting your body weight if you're bending, if you're bending at the waist. So you're lifting all your body weight. So,
right.
So that's the way a lot of people do get hurt, is they think, I'm just bending over to pick up a piece of paper, but they're actually lifting their body weight too. So we teach that in class, how to properly go about lifting something off the floor, even if it's a minor thing. People don't think anything of it.
But it's probably better exercise and better for our bodies to do a squat, right? Because we're using more energy, we're using more muscles in where they're designed better. I would assume. I don't know. Well,
you hit it right on the head on the last one. Your muscles in your legs are the most powerful muscles in your body. Okay. And so they're designed to handle that load. What we'll find when we train folks to lift properly is they're actually going to have a lot more energy, at the end of the day, because they're using the muscles that are designed to do that heavy lifting instead of using the muscles that aren't designed to do that heavy lifting. So went into companies and trained folks, and they're like, wow, my back isn't killing me at the end of the day. My shoulders aren't killing me. My neck's not killing me. Their legs might be a little sore, but I mean, that they'll get over that because the legs are, that.
Your legs will keep building, right? They'll just get used to that.
Yeah, I mean, they're made to do that. There's not discs, there's not structures that you can injure, in the legs. There are, you can injure your knees, and that's another downfall of what we call the squat lift technique, is it's really hard on the knees because you have to bend the knees so far. If you get in a wide stance, the power lift technique, you don't have to bend the knees, and it really helps that out. So it's just a great lifting technique, and it's fun to go train in companies because kind of the light bulb experience. The light bulb goes on. When you show someone this is the old way to do it. Show me your way, and then I'm going to show you this way, and then you compare, and they're like, wow, I can't believe I haven't been doing this, a long time ago.
Well, so. and that just brings up the question, and also I think I realized, because when you throw your back out, it hurts, and then nobody can really understand your pain. So then I know that, like when I'm shoveling, and we're down to the end of shoveling, and so then I instead of going through the steps, I just try and go as hard as I can, and I twist and I do that whole thing. It hurts. Yeah. So sometimes we get lazy and we don't squat down so much.
And you bring up a great point. In just like anything, the more you do it one way, you create a habit.
Okay.
Okay. So if you train your body the way to do something. If you're doing it over and over again, pretty soon it comes natural for you to do it that way.
Just a habit.
And it becomes a habit, and you have neural connection. And we can go into we're not going to go into the neurophysiology of it, but when you do an activity such as a lifting activity and you do it multiple times, if you do it enough, your mind's just going to make that connection with your body to do it that way, the way it's trained.
Really?
Yeah.
Cool.
And so, shoveling's one of them. Just if you think about day-to-day things, how you do things, pretty soon it'll become natural for you if you do them, in a particular way.
So doctors always say practice good habits, right?
Yeah.
It's easier said than done.
It is. And one of the things that we see too is there's so many, in our profession, the healthcare profession in general, nurses, for example.
Oh, yeah.
Do just a ton of lifting and ton of, material handling, whether it's pushing carts or, helping patients or clients move. And that's one of the neat things with Powerlift and that's what I actually just got certified in is working with folks in that industry and with nurses and assisted care facilities and extended care facilities.
Oh, wow. Where you absolutely need that, right?
So, and it's again a divergence on the typical powerlift technique. It's more specified to, how do we deal with someone who can't move? How do we lift them and go in and train those folks how to do that? So, really a cool program.
So is there if a nurse or an assistant at maybe a nursing home, could they just come and learn that and take a course from you, or is it just something that an institution has to bring you in? Yeah,
that's a good question. Both. We'll give techniques, tips and techniques. That's no problem doing that. I have a lot of nurses as patients, in the clinic, and so we work with them a little bit one-on-one, and
sure.
Just real simply, but can actually get certified in the powerlift technique. And gain a certification for your company, and that would require me to come in actually and do some training. And it takes, depending on the time frame, what a company has available, we can do it in an hour, we can do it in 3 hours or 8 hours, and it depends on the size of the company, how many employees they have, how in detail. So the best way to go about doing that is to get in contact with us and say, hey, I've heard about this Powerlift, or we need some back safety training, and then that's an avenue that we can go down.
Doctor, thanks for the powerful information on Powerlift today.
Sport and Spinal Weekly continues. Get more online at chiropracticsport and spinalrehab.com.
Has your vehicle been making noise? Get your vehicle repair done by the best. Bemidji's Best Auto Service. Bemidji's Best Auto Service is a full-service auto maintenance and repair shop. From headlights to taillights, tires to the top, and everything in between. Bemidji's Best offers honest and always a fair price. It's what they believe in and how they do business. When your vehicle needs a little help, visit Bemidji's Best Auto Service. Just a block north of the Eagles Club on Washington Avenue in Bemidji. Bemidji's Best Auto Service.
Preventing work injuries in the workplace is especially important in this economy when employers need to reduce costs related to work injuries. Chiropractic Sport and Spinal Rehab in Bemidji offers complimentary back safety talks to local businesses with options of complete training and certification, which could potentially reduce workers' compensation claims and insurance costs for employers. If you or your workplace is interested in back safety, please call Chiropractic Sport and Spinal Rehab in Bemidji to schedule your back safety talk today.
Hi, I'm Jennifer, insurance specialist at Chiropractic Sport and Spinal Rehab. Call me to find out how your insurance benefits can help pay for your care. You can contact me for all of your insurance and financial questions.
Get fit now at the Gillette Fitness Center, located on the BSU campus in Bemidji. Go for a swim, run a few laps, take a yoga class, or just work out. It's all here for you. The Gillette Fitness Center offers state-of-the-art equipment and facilities that will help you slim down, tone up, de-stress, or just plain play. With flexible membership options to help you achieve your fitness goals. Open 7 days a week. Visit the Gillette Fitness Center, located on the BSU campus in Bemidji.
Huge savings now at the area's only new and used vehicle superstore, Honda of Bemidji and Bemidji Chrysler. Choose from the biggest selection ever with over 200 new vehicles available, plus a huge selection of top-quality pre-owned cars, trucks, vans, and SUVs. Drive in and see the biggest selection ever at the area's new and used vehicle superstore, Honda of Bemidji and Bemidji Chrysler.
Your recovery from injury is so important to you and your family. If you or someone you love is in need of physical or occupational therapy, request Choice Therapy of Bemidji. You do have the right to choose where you receive therapy services. Choice Therapy will work closely with your physician, giving every patient the highest quality care possible. Choice Therapy also offers free 15-minute injury consultations to see if therapy will help you return to top form. Your life, your health, your choice. Choice Therapy of Bemidji.
Have you had the misfortune of experiencing an injury recently? Chiropractic Sport and Spinal Rehab of Bemidji is equipped with a comprehensive treatment and rehab program for auto, work, and sports-related injuries.
Chiropractic Sport and Spinal Rehab also offers a complete wellness program for all your health needs. They're committed to helping you achieve and maintain your good health. Call Chiropractic Sport and Spinal Rehab at 444-2117 and visit them online at www.sportandspinalrehab.com. That website again is www.sportandspinalrehab.com.
Sport and Spinal Rehab treats the whole family in a comfortable, friendly atmosphere. Sport and Spinal accepts most insurance, so give us a call. Again, that's 444-2117. Chiropractic Sport and Spinal Rehab. Renew your whole body, your whole family, your whole life.
River City's weather.
On the River Weather Eye Weather Center, I'm staff meteorologist Mandy Valuber. We have a winter storm watch going into effect Saturday night. Friday, mainly cloudy skies. Just a slight chance for snow showers as the system wraps up. We're looking at just a coating. Northwest winds breezy, high of 19. Tonight, a slight chance for flurries, 4 degrees for your low. Partial sunshine Saturday. Right now, 12 above.
Hi, I'm Erica at Chiropractic Sport and Spinal Rehab. I assist the doctors with patient care, exams, therapy, and x-rays. Call us to find out how we can help get you out of pain today.
All right, Sport and Spinal Weekly, we're back. Our guest with us today, Jason Brodina, Choice Therapy. Good morning.
Hi, Mark. How are you?
Good. Say, I remember when the last time you were in, and I just kind of wanted to find out, how did the open house up north at Kelliher go?
Great. We had over 100 people show up. It was a great chili, great event. We teamed up with Sport and Spinal, and it was an all-around great event for the Kelliher area and for our clinic. It was really good.
And you guys are still rolling and going up there, I'm sure.
Yep, we're getting busier and busier. Every time I talk to Marnie, who's our main therapist up there, she's asking for help, more and more help all the time, so that's a good thing.
Excellent. Well, and then when I asked you what are we talking about today, and you said you wanted to talk about the falls, and I was thinking, international falls? Are you guys going up there? What's going on? And then I realized, when we fall as human beings, right?
Correct. A big thing that we see in our profession of therapy is people getting injured, and it's especially prevalent up here in northern Minnesota when we are dealing with ice and snow.
Sure.
And one of the big things that we can prevent is falls, especially in our older population. One of the big things we want to try and prevent is people that fall and break a hip.
Ooh.
There's just tons and tons of statistics out there that show when people fall and break a hip. One of the statistics out there is if somebody falls and breaks a hip, 1 out of 5 hip fractures die within a year.
Your kid's almost deadly.
Yes, and so it's very, very, very dangerous. And one out of 4 adults that fall and fracture their hip end up in a nursing home a year later.
Wow. Well, I would assume it's kind of like the whole pivot point to your body, isn't it?
Well, what happens is people fracture their hip, they end up in bed, they get weaker, they develop pneumonia, and all these other complications happen. So it's falls can be very deadly.
Devastating, I see.
Or you can get a fall, hit your head.
True.
And so you can get brain injury
Right.
with the fall.
Coma.
Yeah, and so when we add in all of the things that from falls, it is very dangerous. And the biggest thing is we can prevent falls.
We can.
There's numerous ways. We see a lot of things as far as what makes people fall. Well, we all think of we trip on something.
Okay.
Well, why do we trip? Well, there's 5 ways to prevent falls. First one is to get your vision checked, because if you can't see what's in front of you,
Okay.
you don't know what's there. The next one is reviewing your medications with your doctor. What they say is if you have 4 or more medications, you're at a significantly high risk of falls. So people that take several medications have a really high chance of falling.
I would assume. That's a lot of chemicals in your body.
Yep. Another way is making your home safe. Now people will say, "Oh, my home is safe. I don't have to worry about anything." Well, your grandchildren come and visit for the weekend.
Okay.
And all of a sudden you know your hallways, you know your house. But the grandchildren were up till 10 o'clock and they left the remote control car on the ground and you're trying to go to the bathroom at 3 in the morning. And you step on that car and it's got wheels on it. What do you think is going to happen? You're going to end up on your back on the floor. So just making your home safer, environmental awareness, knowing what's in front of you.
Okay.
If you're going to walk on the streets or on the sidewalks, don't do it at night. Walk in a well-lit area. Walk with a partner. Stay away from ice. Watch for cracks in the road. You're walking across the street, well, I got to beat that light.
Right.
Well, if you're not able to do that and you try and rush across the street and it's icy out, you have a chance of falls. A lot of it is common sense.
Right.
And then probably the 5th one is a regular exercise program. And we try and help people with that, setting up with regular exercise. That's a huge key. The better in shape you are, the stronger you are, the less you have chance of falling.
Or if you do fall, you have a little more strength, physical, muscular.
Yes. One of the things is keeping your lower body strength. If you fall in your house and you don't have enough strength to get up off the floor, and you don't have a lifeline, things like that,
right,
you're going to lay there for an extended period of time. And so simple exercises to help improve that ability to get up off the ground are important. Now, as far as when I try and teach an exercise program to prevent falls, there's 3 main areas that I try and key in on. One is stretching and staying flexible. Another is strengthening, especially for your legs. And the 3rd is balance. Working on balance. Simple exercises as far as putting one foot in front of the other and standing in one spot. Trying to work on your balance. If you're able, standing on one leg in front of your countertop or bathroom sink. That'll work. Doing that every day, working on your balance. We all fall every day. Mark, you fall.
Oh, I fall up the steps. I do all kinds of stuff.
But we all fall. We all lose our balance. We may trip on something. We may see something in front of us and we kind of fall to the side. But what do? We all regain our balance.
Okay.
The younger population for the most part. Well, the older population isn't able to grasp their balance and catch themselves before they fall. So if we are working on that with an exercise program, that's a big way to help prevent falling.
Certainly minimize when you get to an older age, right?
Certainly minimize. Another thing that I didn't hit on a little earlier, but making sure your home is safe. Most of our falls, I can't remember what it is, it's like 60 to 70% of the falls happen in our home.
Tripping over something?
Yes. I'm young, I'm 35, Mark. I have night lights all over my house.
Oh, do you? Okay.
Because it's safer. They make night lights nowadays that turn on when it gets dark. And if you are especially an older adult and have compromised balance or strength, a $2 night light is well worth it.
Great investment.
A great investment. So that is something that I really encourage people in a home environment to be safe.
Makes a lot of sense, and like you said, it's common sense, right?
It is. All things come to common sense, but you really got to make sure that you're working with your doctor, working with your optometrist,
right,
and doing some type of exercise program.
And as we get older, we're seeing those types of physicians more frequently because we are getting older. But I like that you brought up the point of just standing on one foot. I would assume that when we get older, just like anything else, we tend to do things less, right? Less exercise. And that's a simple one that I could see immediately would help someone.
It would. I tell people you just incorporate it into your daily routine. If you're standing doing dishes, well, put your feet real close together. You still have that countertop to hang on to if you do lose your balance, yet you're washing dishes and you're challenging your balance the whole time. Instead of having your feet wide apart, put them close together and work on your balance for the 5 minutes that you wash dishes. You can incorporate a treatment or exercise program into your daily routine. Before you know it, you're working on the stuff all day long.
And you'll be able to tackle a fall a little easier.
And you're able to tackle a fall and prevent those falls. And I do encourage it. Anybody that is at risk for falls, we do have lots of resources at our Choice Therapy Clinic that we can give. If you have an older adult at home that you're worried about falls, we do have a falls checklist that you could step by step take people through. It's about 10 questions, yes or no, and it'll tell you what type of risk your significant other or your person that you're worried about is at risk for falling.
Oh, perfect.
So there's lots of resources out there. You can go to the website for the Center for Disease Control, the cdc.gov, and they will have tons and tons of info on ways to prevent falls.
It was ironic that Dr. Erickson is talking earlier about lifting, power lifting, and lifting properly, and individuals that need help, like at nursing homes where people are need lifted or have fallen.
Yes, and so you see that in, once again, you can kind of talk about nursing homes and lifting. Lifting is very important as far as using the correct technique. If you do have somebody that, a person that you care for falls to the ground and they can't help you lift them up, it's very important that you use correct body mechanics to help them get to a chair or couch.
Or you too could be in some pain.
Or you'll be coming to see me at Choice Therapy.
Jason, thanks for coming in today.
Thank you, Mark.
Questions for the doctors? Email your question to ssweekly@paulbunyan.net. This is Sport and Spinal Weekly on 92.1 The River.
Have you ever been told you just have to live with the pain? Far too many people today are living needlessly with pain and taking drugs to hide their pain. Every day, many people just like you are learning chiropractic care can be an effective alternative to drugs and surgery while restoring pain-free living.
For quality chiropractic care, call Chiropractic Sport and Spinal Rehab of Bemidji at 444-2117. Whether caused by an auto accident, work injury, or other circumstance, receive expert treatment from Sport and Spinal Rehab. Sport and Spinal Rehab will accept most insurance, so give them a call. That number again is 444-2117, or find them on the web at www.sportandspinalrehab.com.
Chiropractic Sport and Spinal Rehab. Renew your whole body, your whole family, your whole life.
For more information, visit Chiropractic Sport and Spinal Rehab online at www.sportandspinalrehab.com.
Has your vehicle been making noise? Get your vehicle repair done by the best. Bemidji's Best Auto Service. Bemidji's Best Auto Service is a full-service auto maintenance and repair shop. From headlights to taillights, tires to the top, and everything in between, Bemidji's Best offers honest and always a fair price. It's what they believe in and how they do business. When your vehicle needs a little help, visit Bemidji's Best Auto Service, just a block north of the Eagles Club on Washington Avenue in Bemidji. Bemidji's Best Auto Service.
Your recovery from injury is so important to you and your family. If you or someone you love is in need of physical or occupational therapy, request Choice Therapy of Bemidji. You do have the right to choose where you receive therapy services. Choice Therapy will work closely with your physician, giving every patient the highest quality care possible. Choice Therapy also offers free 15-minute injury consultations to see if therapy will help you return to top form. Your life, your health, your choice. Choice Therapy of Bemidji. This is Sport and Spinal Weekly on 92.1 The River. Get fit now at the Gillette Fitness Center, located on the BSU campus in Bemidji. Go for a swim, run a few laps, take a yoga class, or just work out. It's all here for you. The Gillette Fitness Center offers state-of-the-art equipment and facilities that will help you slim down, tone up, de-stress, or just plain play. With flexible membership options to help you achieve your fitness goals. Open 7 days a week. Visit the Gillette Fitness Center, located on the BSU campus in Bemidji. You're listening to Sport and Spinal Weekly on 92.1 The River.
All right, well, that wraps up this week's show. Thank you to Jason Brodina for coming in from Choice Therapy. And a tip this week? I know we gave one earlier in the show.
Well, I'm going to just reiterate that tip because, you know, we are dealing with the snow stuff. And it's so important. And like I said, practicing perfect makes perfect, right? And so really when you're shoveling, just think about your stance. Do a really wide stance technique when you're shoveling. You know, keep your shovel out in front of you. Don't bend, twist, and lift at the torso.
Don't bend, twist, and lift.
Move your feet instead of bending, twisting, and lifting, and it'll be great for your back.
And you don't have to do it all in 1 hour.
Good point. Yeah, pace yourself. Exactly.
Sometimes we fatigue ourselves and then we get injuries,
That's when the injuries happen, for sure, Mark.
So I've learned that from you, Doctor.
Yeah. You're paying attention.
Coming up next week?
Next week we're going to have someone from the Bemidji BSU Rec Center talking about some activities that they've got available over there.
Once again, thanks for coming in.
Yeah, thanks for having me again, Mark.
Hi, I'm Nicole from Chiropractic Sport and Spinal Rehab. Stop by the front desk at our office and I can help you schedule your appointment, or you can just give me a call at 218-444-2117.
Get fit now at the Gillette Fitness Center, located on the BSU campus in Bemidji. Go for a swim, run a few laps, take a yoga class, or just work out. It's all here for you. The Gillette Fitness Center offers state-of-the-art equipment and facilities that will help you slim down, tone up, de-stress, or just plain play. With flexible membership options to help you achieve your fitness goals. Open 7 days a week. Visit the Gillette Fitness Center, located on the BSU campus in Bemidji.
Preventing work injuries in the workplace is especially important in this economy when employers need to reduce costs related to work injuries. Chiropractic Sport and Spinal Rehab in Bemidji offers complimentary back safety talks to local businesses with options of complete training and certification, which could potentially reduce workers' compensation claims and insurance costs for employers. If you or your workplace is interested in back safety, please call Chiropractic Sport and Spinal Rehab in Bemidji to schedule your back safety talk today.
Thanks for listening to Sport and Spinal Weekly, brought to you by Chiropractic Sport and Spinal Rehab. For more information, call 218-444-2117. Email ssweekly@paulbunyan.net or visit Chiropractic Sport and Spinal Rehab, north of Beltrami Electric in the Technology Park. Join us again next week for another edition of Sport and Spinal